This computer. Josh White, how are you?
Good. A little tired. I just finished a night shift, but have the rest of today and tomorrow off. So looking forward to that.
Friends of the RockneCast, you are going to be really pumped for this particular interview of Josh White. Josh White does so many different things really, really well. It's sort of like, where do you begin to start? I think of how do you classify Josh White? He's sort of an adventure athlete. He's a rebel. He's an MD. He has a lot of good, interesting, provocative political commentary. He's a dad. He's a husband. Where do you begin to start with Josh White? But why we're bringing him on this particular show is he also has this incredibly interesting story of a medical initiative in Haiti, Unity Point Medical Mission in Haiti. And I thought, wow, what an opportunity to bring on Josh White. As previous listeners of the RockneCast have known, we've sort of had this surprising interest in Haiti. We did Toussaint Louverture with Lee Simon, Lee Simon. He did a incredible play series on Toussaint Louverture. We learned all about the Haitian Revolution. And that particular part of also the American story, the impact on the United States. We did a show with Corey Graham, who did a year in mission work, and we sort of described the sights, sounds, and feels of Haiti. And that got me thinking, wow, my friend Josh White was not only all of those things, but he's originally from Decorah, Iowa. And I thought, wow, I'm going to call Josh. And Josh has been gracious enough to join the RockneCast after a full shift. So if he looks a little tired, which I do too, I just got up, it's because he's doing the RockneCast after a full night of work. So I'm so grateful that you're on today, Josh. It's so good to see you. You know, those of us who grew up in Decorah, Iowa, you know, once a Decoran, always a Coran. It's sort of like we're patched in. We got to do a reality TV show sometime on people from Decorah. You know, it's going to be sort of like, Sons of Anarchy. It's going to be Sons of Decorah. You know, we like Rumagroot. We like, we like to throw stones. But here he is, Josh White. So I've just had a long wind up. Josh White. Who is Josh White? And then we'll get into your experience in Haiti. Who is the Josh White?
Who am I? So yeah, I guess as you mentioned, I had a lot of interests. Went to Luther after high school. After that, went to med school at the University of Iowa, graduated from there in 2001. Did a residency in emergency medicine at Bay State in Western Massachusetts. Finished there in 2004. Went back to Minnesota after that for 6 years. And while in Minnesota, married a girl I'd met in Western Mass, Kim. So we've been together for 17 years now. After Minnesota, came back out east, but I didn't want to be in Massachusetts. And so Kim and I started up a little farm in central Vermont. And so we're running a small flock of sheep and a bunch of chickens and a bunch of dogs, and on a mountainside, and enjoying that quite a bit. We got two kids, a 10-year-old boy and a 13-year-old girl. I've been following your exploits in your podcast, and a lot of your interests track right along with a lot of what we're doing. My daughter's diabetic, and our food journey has been somewhat similar to yours.
We could almost do, it's sort of funny because when I started to do the podcast, the thing that you're supposed to do in a podcast is you're supposed to specialize. So you're supposed to only do one topic, and then you're supposed to like only do that. So you could only do it on fasting, or you could only do it on protein, or you could only do it on keto or whatever. And I thought, well, hell with that. I'm a guy who sort of rebels against most rules. And I don't want to do that. It's just too much. And I don't know what I'm going to be interested in. And I wanted to keep the ability to interview on Haiti or food or whatever. But I would say that I would love to do more podcasts with Josh White as a trained medical doctor on these sort of, rebel doctors in terms of challenging the conventional view of diet and nutrition, calories in, calories out, with the conventional view. And as many of you know, I've lost a whole bunch of weight. I've done intermittent fasting. There's these dialogues between the convention with the hormonal theory of obesity, insulin theory of obesity versus. So stay tuned, guys. If you like this particular RockneCast, you're going to love all these other ones because I bet Josh would weigh in on some of those topics as an actual.
Oh yeah.
I'm a Juris Doctorate, so I have no medical. I'm a dilettante. I have no medical training whatsoever. Whatever I say related to medical treatment or diet, ignore it all. I'm just always sharing my experience, but we'll do that. But there's a lot of different topics. You also know Ben, Permaculture Ben. What's his name?
Yep, Ben Falk.
Ben Falk. Yeah, no. So you are doing, anytime, Josh, you probably have a good mood because you always have a lot of, positive things you're doing in your life. Think about how many people dream of starting their own sheep farmer. Like I drive Mara crazy because I'm like, I want to be a goat farmer. So you actually are a sheep farmer. And I'm so impressed with that. But it's not all those interesting things that we wanted to have you on for. You also have this incredible story of you and a colleague of yours, I understand at the University of Iowa, started a medical program, nonprofit to serve the wonderful people of Haiti.
Yep.
I have not been to Haiti, but it is definitely on my bucket list. I know so many people. I mean, ranging from, I don't know Bill Clinton, but Bill Clinton loves Haiti. My brother-in-law,
I saw Bill Clinton in Haiti. After the earthquake.
He absolutely loves it, and I just think of its culture, its people. It's such a fascinating place. And one of the things I tried to emphasize in my Toussaint Louverture episode, it's also one of the most important nation states in the Western Hemisphere by far, in terms of its impact on the United States. And I think that story is not told, but it also has a lot of challenges and needs. And your organization has tried to fit one need, which is medical assistance. So if you could just give a little bit of the origin, first of all, what is the name of the initiative and how did it start with this colleague of yours at the University of Iowa? It's a very inspiring story.
Sure. So the gentleman you're referring to, Chris Burish, he and I were effectively roommates in medical school. And he went on and did a pediatrics residency at Wake Forest. And while there, did one trip to Haiti. Shortly after residency, he called me because he was going back. So I believe this is about 2004, 2005. And they were looking for doctors and asked if I wanted to go. And I did the standard thing at that time and pulled up a map to figure out where exactly he was talking about, and agreed to do it. Have done a lot of relatively adventurous things in my life, so this wasn't that far out of character, and went down to Haiti. Loved the experience. It turns out my training in emergency medicine works really, really well in that environment. You get, comfortable seeing whatever comes through the door, no matter what, anything from, a laceration to a pneumonia to an advanced cancer, training in trauma and infectious disease and tropical medicine. So it was a nice fit.
So let's back up a little bit. I mean, did you coordinate with an existing organization? Did you just show up? Give me some sort of granular details in terms of, like, you both have a passion to serve. Did you plug into an existing nonprofit? How did that actually start in terms of on the ground?
So we had plugged in to an existing nonprofit, and it started to become kind of an annual or twice a year thing. But it didn't take too many years before we started to become kind of dissatisfied with what was happening. And the intent of pretty much everything happening down there as far as aid is good, but the implementation is frequently very, very poor. And what we were experiencing when we went down there is we would go out to a little village, and for lack of a better term, sling pills. But there weren't really records that were being kept. And the medications we provided were whatever happened to be available or donated. There was no consistency. There was a coordinator down there, and you're going to go to this little village because they haven't had a clinic in 10 years. And then the next time, well, you're going to go to this little village and they haven't had a clinic in 10 years. And we started to realize that we probably weren't making a lot of impact,
Yes.
but there was a lot of expense. We didn't know we might be doing damage for people, starting them on the medication, getting their blood pressure under control for a few months, and then they have no means by which to refill.
Yeah. Yeah.
And so we struck out on our own and formed an organization called the Community Health Initiative. Initially, we started to work as a subsidiary of other organizations. That didn't go real well. We found that a lot of organizations had a lot of dogma in terms of this is how we do this, and we wanted to do things our own way, and a lot of the things we wanted to do were really, really difficult and relatively expensive, and was hard on other organizations and their budgets. We got rather significantly diverted with the 2010 earthquake, and ended up running a field hospital down there for 6 months, which was quite an experience. And then I believe it was around 2012, we got our own 501c3. And along the ways, I got an MBA, which informed a lot of what we were doing. Did
you got it? Did you get an MBA just because, or did you get it because you felt that it could help your planning administration for this particular organization?
It wasn't originally intended for work in Haiti. It was an MBA in healthcare. I did it through St. Thomas in Minneapolis and St. Paul. I had started to do some administrative work in when I was doing my ER gig in Minnesota, but rapidly realized, well, there's a standard process in medicine where nurses and doctors and PAs and such, if you're good on the clinical side, you tend to get promoted into administrative roles, with this assumption that, if you know how to manage congestive heart failure, then you must know how to manage a group of people and do HR and schedule, which is
not true. This happens.
Malcolm
Gladwell has done an entire podcast on this, which is why do top salespeople end up being horrible managers of salespeople?
Yes.
One would think that the same qualities that would make you really good at one thing would make you also really good at managing the thing. But it's like asking Michael Jordan to be a basketball coach. It turns out he'd probably be a horrible basketball coach, and he's not that good of owner. Like his eye for spotting, John Elway can't pick quarterbacks. So I'm sorry, I digress. But yeah, so
that's a thing in medicine.
I bet you would be good. I would bet you would be good at manager, though. So I bet you would. You would not suck. You would.
I did an MBA. Well, I'm now the chief medical officer here at my hospital. So I've done okay, I guess.
Do you issue orders around to people? Do you boss people around?
Yeah, there are people that would make that claim. Yeah.
From your Decora, right?
Yeah, but the MBA, I actually ended up writing a whole thesis on the problem with aid delivery. And
is that publicly available, Josh? Could you share that on our show notes, or is that something
I could email it to you.
Okay, that'd be great. We'll include a link for people listening. We'll include a link on our show notes at rocknecole.com, and I think that'd be great.
It'll probably bore most people to tears, but the gist of the concept is that my theory was that the problem with delivery of aid in places like Haiti is the disconnection from the capitalist cycle.
Yeah.
And so if you were to, there in Iowa City, say, start up a hot dog stand, your success would be predicated on, did you do good marketing and figure out where you needed to be, and
Mhm.
draw people there? Did you have good quality product with good hours and good service, and you make money and you stay in business?
Mhm.
um, uh, Aid delivery in places like Haiti or organizations by ours is completely divorced from outcomes.
Mhm.
So I could roll down into Haiti, provide some form of medical care, or even lie about it and provide no medical care whatsoever. Come back, tell some stories, show you a lot of pretty pictures, and I'm going to stay in
Yes.
business and make money.
That's.
And it's a nonprofit, so the money goes back into whatever I'm doing.
Mhm.
But you don't have to do the things that normally keep a business afloat when you're providing aid.
Mhm.
And a lot of those things are hard,
Mhm.
particularly when it comes to medical care.
Yes.
And a lot of these things are administered by people that don't normally manage medical practices, churches, and the like.
Yes.
And so these things don't get done. And people tend to focus on a lot of measures, false return on investments and such. Like the classic one is, a team will go down there and they'll come back and they'll say, we saw 1,000 patients, and
Yes.
everybody pats themselves on the back. But when you go to your doctor, you don't want to see 10,000 seen. You
Yeah.
want your knee to stop hurting. You want your cough to go away. It's not a
Yeah.
measure of quality.
Mhm.
And everybody falls into that trap
Yeah.
from churches all the way to the U.S. government. If you look at the reports on the earthquake response from the U.S. government, it talks about how
Mhm.
many patients they saw.
Yeah.
So, um, so that thinking informed a great deal of what we did. So that we wanted to develop a medical record system, so that when we saw a Haitian patient, we came back and saw that same guy or that same woman again. We knew what we had done. We knew what medications they were on.
You could
We'd be
track
able to,
progress.
yeah, we'd be able to decide, did that work? Did that not work?
Yep.
Um, Refill those medications, and adjust to actually try to produce some measure of health in chronic conditions.
Oh,
Um,
this is great. And let me jump in here because I want to. I think that there's something called the TED Talk phenomena, which I remember 10 years ago. I just sort of just, oh, I love, and I still love TED Talks because TED Talks serve a role, which is how do you make people that are doing interesting things, how do you spread the message in such a way that is very intriguing, engaging, and will get people interested in moving forward? That's the good part about TED Talks. The bad part about it is that it makes everything look like, and I think this is especially something for 20 and 30 somethings, that we're just a 20-minute TED Talk away from solving incredibly complicated issues, right? And you can almost think of like in the medical care. I always like to joke about sort of make up TED Talks. Like, what if, like you're in the farm space, what if we brought organic food to the medical industry and had healthy, nutritious food for our medical patients? Why do we have sugary drinks in the hospital setting when we could be feeding them goat keeper and they would solve their health issues? Like, okay, that sounds really cool. And the audience is like, yeah, that's really cool. But that is extremely complicated. The
yes,
hospital may be administering a federal grant and there may be industry contracts, and they also have to make sure that they have standard of care so they don't get sued. And what if you tried a keto diet for all your hospital patients and all of a sudden someone got salt deficiency or something? Like, I mean, it's super complicated, and you got to have a model. There's a entre that I like that he based, Guy Kawasaki. He did a lot of entre stuff in the West Coast, and he said if you don't have a prototype, basically go to hell, because you can do a PowerPoint to the cows come home, but it's not worth anything. And the other thing is I should have been a philosophy major. What makes me think with the nonprofits, I think this is a frustration of Corey's, my brother-in-law. Have you ever heard of deontology? Deontology, like if you
oh
say
yeah,
deontology, like as you swirl your cognac. But this notion of it's our intent that matters, and I think so many of our nonprofits are like, I'm doing something. I have good intentions, and so
oh
I'm
yes,
gonna I'm gonna get a nurse, and I'm gonna go to Haiti, and we're all gonna go there and have our bellies out and our margarita, and we're doing something. And that to me, in terms of all the problems we have in this country, intent is not enough. It has to be outcome. So it sounds like your organization was, yeah, we want people to be inspired. We want to give the TED Talks, but we want to make sure that there's a reality connected to what we're doing, and that it's not just this Potemkin village to make ourselves feel good. Am I getting that right? It seems like you guys are like, no, we want to basically be there over time and provide high quality healthcare for these people rather than just photo ops.
Yeah, that was the idea, with the long-term trajectory being transition to a Haitian run system that we
Mm-hmm.
support, because the a bunch of folks from the US running down there, even every couple of months, is
Sure.
inherently non-sustainable. And what happens in the meantime, if
Yeah.
someone gets sick when you're not there.
Yep.
And so, actually, a lot of events recently, both politically down there and COVID, forced the organization uh, into that model. Fast transition now in terms of making that transition, but it's a necessary thing.
Mm-hmm. Yeah. No, absolutely. And I'd imagine now with COVID, the other issue would be is that you are able to get more Zoom, right? Are you going to more of a telemedicine model, so you can basically act? Because you think the other thing that you and I really like is called permaculture, and one concept I like
Yep.
from permaculture is it's a stunningly obvious concept, which if you're talking about change in your life, look at concentric circles out from you as an individual. So what do you have greatest impact? You. After you get to you get your household. After you get to your household, you get to your front yard and you plant food there. After you get to that, you get to your block, your neighborhood, your city, your state, but you guys are actually, Haiti, and you're right, it's not sustainable over time for you to go down to Haiti, which is a plane ride and all those sorts of things. So how, as the organization grows, are you able to get some of the infrastructure? Have you been able to get some and then of course permanent staffing, which is extraordinarily expensive? So how are these growing pains? Like, is the organization still, you got some full-time staff, or what's sort of the status of it right now,
Yeah,
um,
they're
in terms of the organization?
running all Haitian-led clinics. So I no longer sit on the board. There's a scheduled exodus, with concept being that we didn't want the same individual
Yes.
managing long term, and um, the particularly now the timing was good. Trying to run a hospital during COVID is not what I would call fun. Um, but
Yes. As they say in the South, Josh, bless your heart for all the work you've been doing. I mean, I'm telling you, it had to have been incredibly stressful. So,
yeah.
our medical heroes, and Josh is one of them. You're still doing medicine too. I mean, you're not just the administration, or are
Yeah,
you still,
I pulled a night shift last night.
okay? So you're doing the best of both worlds. So you're a practitioner and you're a manager. That's awesome.
Yep.
But so yeah, so it has been difficult during COVID, and how has that impacted everything?
Actually, my friends down in Haiti tell me that COVID was not a significant problem down there.
Hmm.
I have a number of theories on that, but I don't know for sure why.
Mm-hmm.
The One of the biggest challenges is it's hard to get back and forth. There were
Mm-hmm.
things like quarantines. You couldn't just go to Haiti. The Haitian
Yeah.
government was trying to protect its population.
Mm-hmm.
And then there's been a significant amount of political unrest, which really has been a bigger problem. And that's been the case for a couple of years now.
Mm-hmm.
And the I think it's quite a bit more dangerous at the moment than it has been for a bit. It's always hard to tell, and when you're looking at things like news organizations and State Department warnings, they're almost universally overstated and have different motivations than what seems to be expressed. But I have friends down there right now that are telling me literally, don't come. It's not safe, which I've never heard them do before. Um,
It's sort of funny when Corey started going down there, he actually brought his family down there. And one of the hardest things to do as people, I think probably like you and I, is to sort of think about what perceptions or what's being communicated out to the public writ large is actually true, and which part is just sort of a construction. And I
Yep.
remember when he went down there, I was like, and what is the security of your person? And I think a lot of times people say, well, it's just as safe as some of our big cities or these sorts of things. But he went down there, and for the people that had been down there, my sense was, yeah, there were some issues, but people generally felt relatively safe in terms of security on their person. But that seems like that is not the case as verified by people in Haiti, as well as people like you probably know that still go there quite frequently.
Yeah. And then there's also the reality that, it's this whole country. So, I know people in a certain region, and mostly that may not be the case, in different parts of Haiti.
Hmm.
So there's an old saying in Haiti, that might be true, which pretty much applies to everything I say.
Yeah, no, I was gonna say, it sounds like Greek philosopher right there. One of the things I also learned, and I want to do a deeper dive on this maybe for another podcast, is I also learned that Toussaint Louverture was a Stoic. So I think that's pretty cool. Um, and so the organization, as of right now, are you're not on the board, and by the way, I think that's a really good idea not to be on the board, because the other thing that Corey ran into was you get a savior complex, or it's a my train set concept as a founder of an organization. And so what he ran into as the founder, it was her pet project. Her ego was attached to it, and it was hers. And so any different perception, and I think to me, especially when you're doing aid work, is the exact wrong philosophy, which is I have a skill set and I want to share that skill set, but I also realize that it might be true. I may be wrong. And other people, especially on the ground in terms of Haiti, are going to have their own wisdom and how they can be adequately served. And so it sounds like right from the get-go, you guys sort of bake that into the DNA of the organization, is that you wanted to get yourself out of a job, right? I mean, you wanted to make sure that your skills were not only being used, but transferred to the people of Haiti, so that they would be able to, leverage their own skills and talents to serve their fellow residents.
Sure, sure. And it's also like the one of the requirements down there is just an incredible tolerance for failure, because
Hmm.
a large amount of this stuff that you try doesn't work.
Hmm.
And it takes an incredible amount of time to get stuff done here down there that would happen quickly here.
Hmm.
So it's really, really stressful. We had lots of board meetings with, all sorts of, people would be crying or people would be fighting, and these are people that generally love each other to a great deal. And I had conflict with people at times, and it's good to bring fresh people in there that are
Yeah.
energized. And it was time for me to step back, and things have happened now, like I said, kind of forced, but that was the original intent, where we've got all Haitian run clinics.
Yeah. Well, the other nice thing too that
And that wasn't really happening.
yeah, and I think the other thing that we're probably going to see is post COVID. I mean, I think we've just sort of found that we don't need to be personally present to do a lot of this stuff. I mean, you can probably take a history, and I'm sure internet might be an issue, but I think now with, like, once they do more satellite internet, I think even in the most remote regions, you can take a history, you can look at, you can observe, you can share files. And I'm sure there's an issue with the infrastructure, but I think any organization worth its salt is going to be able to get that high tech there, so that you can leverage your skills. Because I think, to your point, I was a politician for 4 years, and what really got me out of it was this very nasty thing called the meeting. And meetings can be totally soul sucking if they're not run well, if they're too long. They destroy a lot of organizations, and yet
Yep.
people have no self-awareness as to how destructive they are. And my rule is, I even view with city council, if the meeting's longer than an hour, it's a horrible meeting. And especially where it's one thing if we're sitting in the olive grove, Josh, and we're engaging, and we're having a glass of wine, and we're thinking, I'm not sure whether I know the truth, let me know your perspective. But if the point of said meeting is to basically engage in polemics
Yeah,
where no one is really seeking to understand, like to quote Stephen Covey, to seek first, then to be understood, what, seek first to understand before you are understood, it really can cause a lot and then people lose sight of what the goal is to sort of, serve the people of Haiti. And that's what the mission is. It's not about ego, it's about service. um,
absolutely.
and I think the fact that you guys were able to pull it off, and it's still in existence though, so for people
Correct.
listening on this podcast, if they want to make a donation, I know at some point, my fellow former, well, he's still a current politician, Rod Sullivan, went down with you. Are you
Yes,
guys
Rod is a
still
great guy.
are you guys still doing yearly trips for people that want to go and serve? And two, if people want to make a donation or otherwise get involved, how do they go about doing that? And Friends of RockneCast, we'll put this in the show notes at rocknecole.com and provide this information. So how do people get involved?
So trips are sparse right now, secondary to the political situation I was referring to.
Yep.
But they do happen every now and then. The funds are much needed because what's happening right now is the organization is supporting Haitian doctors and Haitian nurses that are utilizing the infrastructure we set up to practice medicine down there, and um, giving them one of the problems with a lot of the medical education and folks practicing medicine in places like Haiti is if you have no understanding of the culture, you can't do it well.
Yeah.
And so throw a lot of docs and nurses down there, or as is often the case, you get a medical school up in the United States, and we're going to train because there is a medical school down in Haiti. We're going to give them a lecture on what have you. Often there's a lot of nuance in the cultural difference that makes your approach or your approach should be quite a bit different. And if it's not, you're getting it wrong.
And do you do, for people that go down there for the medical doctor, one of the things that Corey talked about was there's a certain amount of the population that's Catholic, there's a certain amount that's Protestant, there's a certain amount that believe in other or don't believe, and then he said there's 100% voodoo, that it really permeates the culture, and not this caricature, but just in an everyday way. How much cultural competency training and or linguistic training do you do for the residents? I think that's probably, do you speak French, by the way, or is it Creole? Is that how?
My Creole is embarrassingly poor.
Okay.
I can understand generally what a patient is trying to tell me, but I still require an interpreter.
And do you do cultural competency training? Have you read up
Yeah,
on the history of Haiti? What sort of cultural competency training you do so you can adequately serve
so
and work with the Haitian residents?
when a provider, a doc, or a PA or an NP comes down with us, or a nurse, they get, I haven't looked at it recently, I'm not sure how it is now, but a 90-page primer on this is what you need to know about medicine in Haiti. These are our protocols. This is why we do what we do. These are things you need to pay attention that wouldn't make any sense in the United States. So they get that in advance. When a team goes down, there's basically a half-day long meeting where we walk through all of that. And then the teams are designed such that all of the providers would be practicing in basically a communal area, where newer providers to Haiti are, oftentimes literally 6 feet away from somebody that's been going there for years, that can answer questions and provide input in terms of what's going on.
And in terms of where it's located, do you try to rotate throughout the country, or is there a particular region where you serve the people of Haiti? Josh? I think we have some technical difficulties.
There you are.
Yeah, okay. So we had some technical difficulties on the RockneCast. We'll get that. You know what? One of the things too is that one of the nice things too for people that are going through the midlife crisis and want to do anything, Anyone can do a podcast. And it's sort of funny. A lot of the really good ones that I like have these technical difficulties too. So, and they don't edit them out. So I may or may not edit them. Um, it makes it. I look at this. Look at my studio. This is my patio. But yeah, so you were talking about where in Haiti you were located. So just want to make sure that
Yeah.
we are recording. Okay.
Yeah. So that was we wanted to focus on a population where we could have a defined group of people where we could measure progress and try to produce a measurable impact. So we go to the same villages time and time again. It is around the area of Akaye, which is about an hour's drive. It's on the coast of the northern peninsula. You leave Port-au-Prince and drive up along the coast, and then there's two main clinic sites. One of them is about, I don't know, a 15-20 minute ride from Akaye just into the banana fields and such on the lowlands, and then another one is about a 5 mile hike up into the mountains. That's really really remote. So
And
you
so
get
is this 365-day a year care, or is this now where you come periodically or they're periodically open, or how does that actually work?
So the structure we set up is that there are medical clinics that occur on a periodic basis, about 5 times a year. One surgical clinic augmenting them. So the medical teams would identify, this gentleman needs his hernia fixed, or this woman needs a hysterectomy because of bleeding fibroids or whatever. And then we trained community health workers. So there would be individuals in the villages that have basic medical knowledge and protocols that they work under. Working with people in terms of, this is, a blood pressure that's a problem, you need to come to the next clinic. Here are the things we do when we are at a delivery and someone's having a baby. There's a lot of incredibly cheap and basic interventions from a public health perspective that have a massive impact. And they're not very exciting. So like you send somebody to a delivery, and they get a little packet with like a clean razor blade to cut the cord, as opposed to the rusty kitchen knife, so the kid doesn't get tetanus.
Yeah. No, totally.
And a little hat and a blanket so you can dry off the kid immediately and swaddle them, and they don't die from hypothermia. And
to that, how about is obesity an issue in Haiti? I know, I was telling before we started the show that I'm into basically all these different health fads, right? And I think the issue with health fads is, what parts are total bullshit and what ones aren't. But for me, for fasting, basically just skipping breakfast, 16-8 is what I do. I've lost 50 pounds. I've reversed type 2 diabetes.
congrats.
Blood pressure is totally normal. So at least N of 1 for me, it has been incredibly effective. And what's the nice thing about fasting? It does not cost anything. It's free. You can do it whenever you want. In fact, you save money. And for me, it's gotten me to this whole world of all this health and fitness just from that one decision to skip breakfast. And so what I'm curious, those are the sorts of simple interventions, but so it's gotten me into the food thing. And one of the things in all these food debates is people go back into sort of ancestral diets versus Western diets, and obesity seems to follow Western intervention in terms of industrial food. So what sorts of obesity and poverty and obesity don't necessarily, sometimes they can be actually directly correlated. The more poor you are, the more obese you are, because you're getting lower quality, more highly processed food. What's the obesity situation down there, and how that you observe, and how is that impacting their health, or are they not suffering from obesity?
There's definitely some. It's not high volume. It's a little bit of a different animal down there. as a lot, particularly when you get out into the, up into the mountains. These folks are living on, maybe $3 a day US.
Hmm.
And so there isn't much in the way of choice, both in terms of what they're able to afford, but also in terms of what's available.
Hmm.
Um, they have some basic things, and that's about it. Rice, beans. It's not unusual to run into goiters up in the mountains because they don't like fish and they don't have iodized salt. And that's the only thing. And you have to have conversations about, you should probably learn to like fish,
Hmm.
because that's how you're going to get your iodine. The Yeah, they don't have a lot of choice. The And a lot of the industrialized food products aren't too much a thing there's a little bit of it. Definitely you see like snack foods and such in the cities, but it's not a lot.
I'm curious. The other interesting part about all these sort of, food fads and all this stuff, there's all these, ancestral living, is sort of recovering this lost knowledge. Have there been any folk remedies that have been conveyed to you that maybe you sort of dismissed initially and then thought, well, maybe there's something there? Have there been any medical things that maybe you learned that you didn't necessarily think were true, or maybe it's been a situation where you sort of had to say, well, that's nice, and there may be some, you know, uh, placebo effect, but I'm not going to necessarily try it.
There have definitely been things. I mean, a lot of the and some of it works, although a lot of it wouldn't really be tolerated by folks here in the U.S. One of the most interesting things I saw, I was intending a delivery,
Hmm.
um, and so this woman had just finished delivering her baby,
Hmm.
and she is on the bed and is exhausted, and they're working on the kid and drying the kid
Hmm.
off, and everything is sort of quieted down, and one of her family members sneaks around behind the head of the bed, and with a wooden spoon, and reaches behind her head and pops her jaw open and rams that spoon down into the back of her throat, and she gags so hard the placenta just pops right out.
Wow.
Incredibly effective. I've never seen anything like it in my life. I don't think anybody in the US would be okay with that.
Well, one of the other interesting things, Mara thinks I'm a little crazy, but I love this Dr. Paul Saladino. He's carnivore MD, and he does really nose to tail nutrition. But the people that are really into that, you know who they study? They study modern hunter gatherer tribes, to look at their dental health, their physical health. And it's sort of laugh out loud funny in the sense that we think that we've advanced so far, but I think in terms of overall mental health, some of the long-term chronic conditions, I do think we have something to learn from some of these traditional cultures. Now, I don't necessarily think, jamming this spoon down, but I think that we wouldn't take that. But there probably are, you doctors, you have been more effective than nurses for about the last, what? I mean, we love nurses, by the way. I love nurses. What I'm saying is, didn't nurses prior to about 110 years ago, a lot of the women-led nurse clinics, and traditionally at that time they were women, but they're not anymore, so don't get all worked up, people. They were more, the docs had some issues because it was all theory, right? It was all dogma. It was about 100 years ago where medicine really started taking off in terms of, increase in mortality and all the, or, reducing mortality and these sorts of things. Um, and I think these traditional cultures do have something to tell us. I know a lot of these people in the health space get into this. Weston Price, who was a dentist that looked at the dental health of a lot of these traditional cultures. But isn't that true that medicine really took off about 110, 115 years ago in terms of
The
efficacy?
impact of medicine has been very stair steps. There have been like
Yeah,
major advances, excuse me, that have had significant impact. Like Pasteur and the discovery of vaccines, and
yeah.
litter and hygiene, and antibiotics. the more recent one sort of have its advent in the 90s, evidence-based medicine,
Yeah.
uh, which still is something that needs to be ingrained. And there's a lot of things that happen in Western medicine that is not and is a problem. The One of the major problems with Western medicine right now is the fascination with all of the high tech medications and
Yeah.
tests with questionable improvement in outcomes, or outcomes that people don't necessarily want or desire, and ignoring the low tech stuff like you're talking about, like things like nutrition and lifestyle.
Yeah,
Um,
sleep. I mean, and so that's why I would love to do subsequent podcasts, because for me, I think too often that, obviously I'm not a doctor, so I can't give medical advice. But the issue is that for us as consumers, we could do subsequent podcasts on this. We have to make a decision about which approach we want to take. Do we want to adopt a functional medicine practitioner that more looks at nutrition, lifestyle interventions first, or do we want to go to a traditional doc and pop a pill? Like, we have to make this decision, like, in terms of what we do. And as I've dived deep into this, I do think that these I want MDs as that baseline credential, but there are more and more MDs that are really challenging this industrial, pill for everything approach, as opposed to the first approach should be sleep, light, um, nutrition,
yeah.
exercise, kettlebells, lift heavy things. And for me, once I've adopted that, I felt a lot better. And part of this is learning from traditional cultures like they have in Haiti, that there are these things that seem to work. And I think in terms of hormetics, like hormesis, in this terms of voluntarily subjecting yourself to stress, certain amounts of stress can be very, very productive. So I'd love to hear, as an actual trained physician, as you sort of sort through, because the ones I've liked have been conventionally trained and then have said, gosh, it's back to what you had said, is what I know really true, right? And to constantly question that, because I always love when conventional wisdom proves to be wrong, as far as
Yeah.
that goes. So I'm hoping we can do a ton of subsequent podcasts, because I'm sure that you have you want to probably get to sleep. And what I wanted to know, though, is that with Haiti, do you have any book or music recommendations that, for people more interested in Haiti, that you'd like to share, that we can post on the show notes at rocknicole.com?
Um, a couple of books I think are worthwhile. One of them is you probably read it, Hot, Flat, and Crowded, Thomas Friedman.
Yeah, no, I don't know if I have. I probably should have.
It's an older book, probably early 2000s. It's had a couple of iterations now, and it connects population, global warming, disease, consumerism,
Hmm.
and puts all of this together in a way to think about our impact on the places we live,
Hmm.
um, that I think is worthwhile.
That's good.
And then in terms of actually the Haitian experience, as it relates to aid, there's a book called Travesty in Haiti. Um, I'm sorry, the author is escaping me right now. But that is a discussion of the failures in aid that we were talking about,
Hmm.
going from large governmental interventions all the way down to little individuals or churches,
Yeah,
and why these things don't work when you just roll down there and do the thing you think is good.
that
Um,
makes you feel good. Yeah, exactly.
yeah. So that's that's a highly worthwhile book, although I say a little bit painful to read, and you'll finish angry. Um,
Yeah,
but it is what it is.
yeah.
My musical knowledge of Haiti is a little bit pedestrian. My favorite Haitian artist is Wycliffe, which
Yeah,
is
well, Wyclef Jean, yeah.
I
Yeah, Corey
think
mentioned
the
him.
standard answer.
Yeah.
I very much enjoy the music when I'm down there,
Mhm.
um, although have not learned a great deal about who's who down there.
Yeah. Well, and I'm sure that, obviously you guys are down there to work, but I remember there was this episode of Doogie Howser. Remember that show Doogie Howser where Doogie, there was like this surgeon who was cracking jokes and having fun, and Doogie got all pissed off. He's like, "Oh, you're not a doctor, yeah, blah blah blah." But he's like, "Hey, man, this is stressful stuff, and so like you have to be able to have fun." And so when you guys go down there, I'm sure that you work super super hard, but you also have some fun too. So are you
Oh,
able to take
absolutely.
some you're able to take some side trips because you got to be able to recharge the batteries? Maybe before we go, just sort of share some of the fun things you guys do as a team to sort of build that teamwork, that camaraderie, maybe some fun trips that you take. And maybe if you could just sort of describe the sights, the sounds, of the smell of Haiti
Sure.
as you depart the airport.
Well, I think that gets it at a really important concept. Haiti is a lot more than a place with a lot of need.
Yeah.
Um,
Oh yeah,
that
totally.
and Haiti has a lot to teach folks like Americans,
Mhm,
particularly when it comes to things like what's needed to make you happy,
mhm,
consumerism, things like that. A lot of the contentious political discourse that's been going on in the U.S. That phrase "you didn't build that."
yeah.
They You see that in real life down there.
Mhm,
I've had interpreters that spoke 5 languages,
wow.
that I'm pretty comfortable are a lot smarter than I am. And it doesn't matter how hard they work, they're scrapping for their next meal.
Yeah.
And Warren Buffett put it well when he said, "I won the ovarian lottery."
Yeah.
Um,
Yeah.
and I feel that way about my own situation. But you'll go into these little villages, and you do the medical clinics, and the women and the children will be in their Sunday best because the doctors here, and they've got Easter bonnet type things and dresses, and they're so happy to see you. And and the team will come back, and it's a very connecting experience on these
Mhm,
teams, because you're in this place, and you're learning these things together.
yeah, totally.
What do you need truly to be happy?
Yeah.
And it's not the next iPhone.
Yeah.
Because these people are, you go into these villages and these kids are playing soccer, and these grandmas are giving you hugs, and there is a whole lot of joy in their lives.
Uh, and
And
you were able
they're
to observe that, like, and I'll be curious clinically how much, and of course yours would just be anecdote. I mean, you're not going to submit it for peer review publication, but just in terms of what you've been able to observe, how much anxiety, depression did you see in terms of patients, and just clinically, and then in terms of observing the culture itself, what was your observation in terms of what people projected in terms of smiling? It seems to be a very joyful culture, but obviously they have some challenges that they're going through right now. But I think in our culture, we have a major issue with stress, anxiety, and depression,
Oh yeah,
and we are horrible at self care in this culture, and it's a crisis. And yet we're taught that we're the richest country in the world, but rich as to what? The accumulation of stuff.
yeah,
While we're time starved, while we're anxious, while we're depressed, while we're fat. Is this what we're supposed to get? This is our
yeah,
glory.
yeah.
Um,
Well, and it's
what
hard to
did
be
you
healthy in that.
Yeah, and what did you observe? I mean, did you treat a lot of clinical, because you would think that with the poverty that there would be the clinical depression, or what did you observe in terms of mental health in Haiti? I'm sure there is obviously a lot of stress.
There's
What?
some, the clinically, I didn't see it a lot, and I don't know. It's entirely possible that I missed it.
Okay.
It's probably secondary to my poor understanding of Creole.
Yeah.
So my own deficiencies. But walking around the villages and interacting with people, you don't see it a lot.
Hmm.
Amongst other things, the community is such a thing that we don't experience. Have you ever read the book Tribe?
I have yes, that's by Sebastian Younger, right?
Correct. Um,
Yes.
that is a great way to appreciate that experience that
Yeah.
he refers to, and that you can exist in a place like New York City here,
Hmm.
and be completely disconnected as far as any sort of community or really knowing anybody. You can have
Yeah.
your own apartment by yourself, work in a cubicle, your quote unquote friends on Facebook or perfunctory interactions,
Yeah.
and that's not a thing in Haiti.
Yeah.
They, these little households that have got, maybe as big as my office and have got 4 or 5 people living in there, in these little villages, and people are working in the fields together, or people are preparing dinner together, or what have you.
Wow.
Uh, it it really makes you reflect on, what am I doing with my life? What are my wants and
Totally.
desires, and is that really what I
Yes.
need?
Oh,
Uh,
yes. I mean, one of the things in terms of this alternative health space, I've sort of dived deep into the paleo space, but one of their theses is it's sort of like, well, what are you calling a fad? Their view is that human beings evolved under scarcity for 3.5 million years. That's a which I think is a fact. And we evolved our neurological system, our digestive system, all of it is evolved for surviving in that context of food scarcity, of moments of very very intense stress. And here's a dog as we walk away from the line or to sprint or whatever, and long moments of tranquility where we're working together in these sorts of things. And that really makes sense to me. And I think in terms of traditional cultures, this is the way people have lived forever. And the fad is not this stuff. It's this recent stuff where this notion that we're not evolved to be in a cubicle with,
yeah,
this industrial light and constant stress is horrible for us. And yet
yes,
that's what we're taught. That's how we're not supposed to live this way. And I think there's so much we can learn from, traditional cultures that, and I'm sure you've connected with that in the mental health space. That's where I think like just to pop a pill and have that solve everything without addressing your diet, nutrition. And what they say that when you have the friend hormone, is it oxycontin or something like that, or whatever, where your
oxytocin.
oxytocin, where you're eating together, and there's all these sort of good vibe drugs that you can get from your brain through being together, that's very healthy for you and your sleep. And I'm sure they got those down, and it's just passed down from generation to generation. I almost think they should do some, I'm sure they have, but like come to our culture and sort of teach us stuff too. I mean, in terms of like how to live, like why do you guys live like this? Once you get the food, once you get the food and the shelter in terms of Maslow's hierarchy and needs, right? Food, shelter, and security, like those are the base things. But beyond that, I think time is something we very much undervalue. That we are all time starved in
Yeah,
this culture, in our pursuit for commodities.
I think our culture gave us all the things that we wanted.
Yeah.
It's and getting into some of the stuff you were talking about in medicine. We got the medical system that we wanted, and a
Hmm.
lot of it was basing that on capitalism.
Hmm.
The stuff that you're talking about. So you've addressed with your health and your change your diet and your exercise. You're no longer got your type 2 diabetes, and maybe you got a primary care provider or a PA that badgers you about little details here and there, and you stutter along until you're 90 and then trip and break your neck and die and nothing
Hmm.
happens.
Hmm.
The medical system in that life, which everybody wants, makes nothing.
Yeah.
Meanwhile, if you kind of get ignored, and you maintain all that weight, and you pick up, a 2-pack a day habit, and drink a 12-pack of beer a day, and Then you have a big heart attack, and maybe you're back in Decorah, and they put you on a helicopter and fly you down to Iowa City and crack open your chest and replace a few vessels, and you spend a few weeks in the ICU and a few weeks in a skilled nursing facility, and now you're on super expensive drugs for the rest of your life. The system makes millions. We got the system we designed. We got the system we wanted. But it's hard to convince people. It's normal to not want to, you sit on the couch. It's normal to, want another cupcake. And so we got the things we wanted.
Yeah, no, totally. Well, Josh, this has been so awesome. And this is going to be the first episode that I'm going to try to, it's basically going to be a simulcast. So you're going to be the guinea pig. So
up to
friends, if it sucks, I'm going to blame it on Josh. No, I'm just kidding. No, this has been awesome. And I do hope you can join me for some of my future discussions as I learn all of these new things, and just to sort of give the skeptical trained eye to say like how full of bullshit I am. But one of the fun things is that there are all this stuff. There's a lot of new information being developed in terms of the human body, like almost day by day. Mara thinks I'm really crazy. My latest thing is I want to learn more about red light therapy. And I've heard there's some good peer review there. So I'm like, is it, and you're going to be like, oh, that's bullshit. But, it's going to be interesting. So hopefully we can, check in on cultural politics. I love what you did with Haiti. And we will post all this stuff in the show notes. And hopefully people will make a donation to this really great organization because, as you know, I like to talk, but so many of us, it's just a bunch of hot air. And I'm not as active in politics as I used to be, in part because my stoicism, am I actually impacting by talk? I like to talk. That's why I'm doing a podcast. But am I going to get angry about it when I can't influence the thing? And so, like, you guys saw an issue, you did it, and it's sustainable. Like the thing that you started is still in existence, right? I mean, it's still there. And now it's even apart from you. Like that to me, because a lot of these organizations, they end up have an exhausted founder and burnout founder, and then it just sort of peters out if the person dies or just gives up or everyone abandons them. But you guys now have started something over time, and you do this on top of being a farmer. You do long distance running too, don't you?
Yep.
And you're a doctor, and you're a provocateur, and you're a character, and you're from Decorah. Yes. So I mean, you got all of these things, and here's the thing: you got to write a book, right? You got to write a book. Are you going to write a book on like? I mean, and you're close to Ben Falk, who's really fucking cool.
Yeah, he is cool.
Yeah, I mean, and Ben has it figured out. I'm like, okay, how do I live a life where I ski all the time and I organic farm and I do YouTube videos? But you're pretty close. Like you got your own. Ben, how many acres you got?
Only 10 and a half. Ben helped me set it up though. And
are you serious?
Like buy honey from him, and
it's a Ben Falk designed farm.
Yeah, his when we bought
our my God, property, we're gonna do another podcast for sure.
Yeah, he helped with the setup and the planning.
Okay, Josh. Okay. We gotta do, once it starts getting, nicer, we got to do a podcast on Josh White's permaculture farm.
Well, someday you should come out and see it.
Oh, totally. You know what? Actually, that's it. I'm going to do an on scene, because the other thing too is like, Mara's been indulgent of my new hobby. And so when I do these travel and go to the cabin and shoot selfie videos, she's like, you're taking a vacation. I'm like, no. It's work. So if I go out and visit you, it's going to be work related, right? It's deductible. I mean, and my audience, yeah, I could bring. You're exactly. I'm stacking functions, the term of permaculture. But so thank you so much. We're definitely going to reconnect. And part of this grew out of my new habit of journaling. I thought, who haven't I connected with? And I thought, gosh, you're such an interesting person. I really appreciate you taking the time, especially after a long shift. I am going to go home to Decorah this weekend. We're going to do some stuff with mom and dad.
Nice.
And
I'm jealous.
we're in that state of life where you know, we're cleaning up the house and doing stuff like that. So we're legit middle-aged men now, Josh. So you know that's your parents a little younger. They're like babies in their 70s, right? How old are your parents?
They're in their 70s, yeah.
Okay, so they're
Oh,
still
yeah.
youngsters. My parents are in their 80s, so we're at that stage. But in any event, thank you so much. Seize the day, learn about the Stoics, do philosophy, do all these different interesting things, and I can't wait to come out and visit you sometime at your permaculture
Absolutely.
paradise in Vermont. Thank you so much. Take care, Josh.
Thanks, Rock. Let's talk
Yep,
again soon.
yep, definitely. All right. See if I can end it. There we go.